Around the world, 850 million people live with renal disease, the fifth leading cause of death globally. Each year, 3.5 million of them are diagnosed with end-stage renal disease and need hemodialysis. Hemodialysis is a burden for patients, and it is very costly for the healthcare system globally. Around $50 billion are spent each year on hemodialysis, more than $85,000 per patient. The dialysis machine connects the blood circulation through a newly created bridge called vascular aXess to filter the patient's blood. Today's vascular aXess options are the arteriovenous fistula, which is a passage created by joining and enlarging an artery and a vein in the patient's arm. It is the first-line treatment, but it takes months to develop. It is not suitable for all patients, and it fails to mature in up to 60% of cases. The central venous catheter is a large tube implanted in the patient's neck. It is usually the standard solution available when waiting for the fistula to mature. It provides immediate dialysis access and is suitable for emergencies, but it carries a very high infection and blood clot risk as it is positioned straight into the bloodstream, leading directly to the heart. Alternatively, currently available arteriovenous grafts are small plastic tubes implanted in the patient's arm to connect an artery and a vein. Grafts can be used for dialysis quicker than fistulas after implanting. However, they often require interventions due to foreign material in the body that result in occlusions and infections and are frequently abandoned. A safer, more durable option is very much needed to drastically reduce the burden and risks for patients, improve their health and their lives, and to lower the overall costs of hemodialysis. The aXess conduit is a novel transformative vascular aXess device made of polymer materials which enables the creation of a new, long-term living vessel for hemodialysis access. The aXess conduit can be used promptly once implanted, and in time, it turns into a living blood vessel made of the patient's own tissue, like a fistula. It is designed to combine the speed to treatment of a graft with the safety and patency of a fistula. The aXess conduit is naturally colonized by patients' tissue cells over time, thanks to its porous structure. Endothelial cells naturally protect against infection and thrombosis. aXess is made of unique, biocompatible synthetic supramolecular polymers that may reduce risks of infections and reinterventions compared to existing grafts. Over time, the bioabsorbable polymers gradually break down in the body as the new living tissue permeates the aXess structure and takes over functionality. The aXess conduit is designed to provide a readily available and durable solution to reduce complications such as infections, thrombosis, and reinterventions compared to existing grafts. It may be a paradigm shift and transform hemodialysis treatment by offering a safer and more durable option to patients. The aXess conduit is an investigational device currently implanted in patients as part of clinical studies, and it is not commercially available.